Atrial fibrillation affects roughly 5 million people in the United States, and that number is expected to triple by the year 2050. One of the main reasons for the increase is people are living longer. Cardiologist Dr. Hashim Khan discusses who is more at risk for developing this condition and reveals a new device for treating atrial fibrillation.
So atrial fibrillation is the most common type of abnormal heart rhythm that we see. It does seem to affect women slightly more than men, and one of the reasons for that is that women tend to live slightly longer than men, so the older you are, the more chances you have of getting atrial fibrillation. It also affects people who have other types of underlying heart disease. If you've had a heart attack, if you have problems with the valves in your heart, you could develop atrial fibrillation. It also commonly affects people who have had high blood pressure for many years, also patients who have had diabetes. At the same time, if you have any underlying lung problems for many years, that could lead to atrial fibrillation.
Dr. Khan describes some of the symptoms of A-fib.
The symptoms will include a rapid heart rate, which leads to a sensation of palpitations. Some patients will complain of discomfort in their chest or chest pains. Some will have shortness of breath. Some will develop congestive heart failure due to this condition. And then there are also patients who just start to feel more fatigued or more tired when they have atrial fibrillation.
There is a range of treatments for A-fib.
The treatment for atrial fibrillation generally consists of medications to try to either slow down the heart rate to a more normal heartbeat, or to give a medication to try to convert the heart into a normal rhythm. There are also some patients who have atrial fibrillation that is not being controlled with medications. Those patients qualify for a procedure called an atrial fibrillation ablation, where a cardiologist who specializes in atrial fibrillation will actually take a catheter into the heart and ablate, or essentially get rid of the areas of the heart where atrial fibrillation comes from.
Strokes are a known risk for people with A-fib.
Atrial fibrillation leads to blood clot formation in the top two chambers of the heart, especially the left atrium. In the left atrium specifically, there's a region called the left atrial appendage. This is a little pouch where blood tends to pool and form clots. Traditionally, we treat this by giving patients who have atrial fibrillation blood thinning medications. Blood thinners work and reduce the risk of strokes, but they come with their own set of problems. Being on a blood thinner for a long period of time especially can lead to serious bleeding complications. Patients can also have other types of strokes which are related to bleeding of blood vessels in the brain, which can be fatal.
Dr. Khan reveals a new treatment to prevent strokes.
There is a new revolutionary way of preventing patients from having blood clots when they have atrial fibrillation. There is a device called the Watchman device, which can be placed in the left atrial appendage and essentially seal it off so no blood clots form there. About 90% of blood clots in atrial fibrillation form in this area of the heart called the left atrial appendage. The Watchman device is essentially an umbrella or a parachute-looking device that can be placed in the left atrial appendage, and thereby preventing any blood from entering it and forming any blood clots. In the studies which led to the approval by the FDA, the Watchman device has been shown to be as effective as preventing blood clots and strokes than standard blood thinning medications like warfarin. This is a very successful procedure. In the hands of operators who have experience with implanting this device, it can be successfully implanted greater than 90% of times. The procedure itself takes 1 to 2 hours. It is a procedure that requires patients to generally stay the night in the hospital.
Dr. Khan describes the procedure to implant the device.
A catheter is introduced into the vein in the leg, and the catheter is threaded up to the right side of the heart. Through the right side of the heart, we're able to access the left upper chamber of the heart and then the left atrial appendage. This device is then implanted over a wire into the left atrial appendage and essentially deployed there, where it remains permanently. This device is important and quite an advancement in the management of patients with atrial fibrillation, largely because it allows us to reduce the risk of stroke without having patients be on blood thinning medications. By having a Watchman device, you can prevent a stroke and prevent bleeding complications.